Hello, and welcome back to In the Hot Seat with Emily DeAyala and Dr. Viviana Coles. I'm Emily, and this is Dr. Coles.
Okay.
So in the last episode, we talked about the female orgasm, and today we are going to focus on the male orgasm. So men can have different kinds of orgasmic disorders, and we're going to talk about early or premature ejaculation, however you want to call it, and then also delayed ejaculation. So where should we start?
Okay, let's definitely, I love talking about early ejaculation. I find that what's great about it is that it's so easy to spot.
Yeah.
It's so easy to determine whether you're at home or in a doctor's office or talking to us. It's one of those things where you know if you're experiencing it. Whereas a lot of the other sexual disorders, it's kind of up to interpretation. When it comes to early ejaculation, the main definition to go by is either orgasming or ejaculating before you want to and before you're intending to, or if it happens in less than 2 minutes. Sometimes it can happen the minute that you go to penetrate. Sometimes it can happen the minute before even trying to penetrate. So it's really common to know what it looks like.
Yes, I will caveat that though with, I think we both view our role as figuring every couple and individual figure out what's normal and healthy for them. So truly, I think that there are women who are okay with their partner orgasming or having an orgasm, I should say, in under 2 minutes. And, when that comes up, I say, why create a problem if there's no problem? If that's working for you, that's fine. And when you say earlier than you want to, I also like to double check expectations.
Yes,
because,
exactly.
I've had guys come in who earlier than they want to means that they want to go for like half an hour, and that's not really realistic.
Or even
for
10
people.
minutes, 15 minutes,
Right.
something that sounds a little bit more reasonable, but isn't really average at all, or even close to average.
Exactly.
So the average time from penetration to ejaculation is around 5 minutes. Now, some of you are going, what?
Yeah.
Some of you
For men to have an orgasm.
For men to have an orgasm,
right.
from penetration to ejaculation is about 5 minutes. And
Or I always say when rapid stimulation or rapid thrusting begins, because that may be through manual stimulation or oral sex or penetration of some kind, right? But it's
exactly.
when that rapid, consistent
You're not
stimulation
changing
is
positions,
happening, right.
you're not taking breaks. And that's, for a lot of people, they listen to them, they're like, oh, I'm well within average.
Right.
But other people really struggle with even getting to the minute mark or the 2 minute mark. And that can be distressing, especially if you do have a female partner who has expectations for a little bit more stimulation, because it is often harder for women to reach orgasm, especially in a small amount of time.
Right.
So it can be a little bit frustrating. And those are the people that tend to come to see us in our respective offices.
Because I do want to add that on average, men can experience an orgasm more quickly than women. So there's what we would describe as an orgasm gap. If you and your partner are trying to achieve simultaneous orgasms, again, I think let us know. But that's a bit more unusual. Some couples do, and that's fine. But I really discourage couples from making that a goal, just because physiologically our bodies are wired differently.
I think from what I've read and what I've experienced with my own life, as well as with friends and clients, it's like 20-minute difference.
It really can be.
Significant difference.
Yeah.
So being able to orgasm for men around the 5 minute mark plus, I think it's pretty fabulous, But if you're really struggling with even getting to the point of penetration, and that's happened more than, let's say, a handful of times, and it happens consistently, we're going to tell you to schedule an appointment, and I'll tell you why. Not to freak you out or anything, but because the more this happens, the more you're digging yourself into a hole with your sexual confidence.
Right. You're building anticipatory anxiety, meaning that you anticipate that you're going to feel anxious or feel distressed, and then guess what ends up happening? You feel anxious. So we got to break that.
And your body reacts to that,
Yes.
and then it kind of keeps the cycle going, and we help break that cycle.
Exactly. We talked briefly in the last video on the female orgasm about some of the underlying issues that may lead to that. And I think with early ejaculation, for most men, I find that it's about anxiety. right?
Definitely about anxiety, which a lot of men will say, I'm not an anxious person. It's not so much that you might be generally an anxious person, but when it comes to something as private and as vulnerable as your sexuality, you can have a lot more expectations on yourself than you do maybe as even a partner, or maybe as an employee or an employer, or how you do chores around the house. You have different expectations that grow from the time you're a child, really.
Yes. And I think just because you may think on an intellectual level, I don't feel anxious, sometimes anxiety or emotions are stored in the body, and they manifest themselves more physiologically than they do cognitively or emotionally. And I think that's what I see with most of the men who have early ejaculation.
Most
treatable,
of the time,
though.
and it's definitely treatable.
Yeah.
Most of the time, that is the case. Then there's a small percentage of my practice that I see where men just don't recognize, maybe they've never tried before, or they haven't actively tried to recognize the point of no return.
Yes.
And you men out there know what I'm talking about, but maybe for some ladies, it's the point where they've reached a certain level of stimulation and arousal that they're going to ejaculate, and there's nothing they can do to stop that.
Right.
So a lot of men who experience premature or early ejaculation will not recognize that point of no return, and so for them it's always a surprise. We can help them to figure that out as well.
So some men who, say that they don't have any issues around ejaculatory control, when I start talking to them, I realize that they're instinctually or naturally doing the stop-start method, which if you're watching this video and you're having issues in this department, is probably something you've come across online or the internet. And essentially that's when, once you realize that you're approaching that point of no return, you slow down, or you stop, or you somehow bring arousal back down a little bit, and then when you're ready, you build it back up, and that can do the trick for a lot of people. It's as simple as that.
That can look a lot like, okay, slow down, or just a moment, or stop right there. If you have that sort of communication with your partner, which hopefully you will. And it helps a lot. It definitely helps a lot. Right. Now, with delayed ejaculation, it looks just as frustrating, but on the other end. So you've got women and men who are sharing that their experience is that their partner is taking forever to ejaculate, and not in a good way. Not in a, hey, let's plan an all-day Saturday, take a break for grapes.
Sexcapade.
It's really very intrusive and problematic, because a lot of them will realize this when they're trying to conceive, when ejaculation is a big factor. Right. And so then all of a sudden there's a lot of pressure, and that creates even more pressure and anxiety and all of that.
Yeah, and for, if you're in a heterosexual, regardless of the kind of couple that you're in, when it goes on and on and on, it can kind of be uncomfortable after a while for the person on the receiving end. And that's something I hear a lot from partners, is that physically it's just hard to keep going and going.
So when we talk about causes of delayed ejaculation, some of the things that I've heard and that I've been able to help clients with is this idea that they need to relax. It's very difficult for them to relax in the moment. Maybe they haven't come down from work stress, but the other thing is that they're not present mentally. Yeah. They're not really focusing on the experience, either because they're thinking about baseball, trying to last longer. Right. Maybe they've spent most of the last decade really trying not to experience early ejaculation, and it kind of goes the other way. Yeah. Or maybe they're taking certain medications that can cause delayed ejaculation. And you definitely want to check that out with your medical doctor or even your psychiatrist, and ask them very specifically if any of the medications that you've been prescribed can cause delayed ejaculation, and whether or not there's maybe a different combination that you can use.
A lot of the SSRIs like Lexapro, Zoloft, Prozac, can be the main side effect. Is that so much so actually that sometimes they're prescribed for men who have early ejaculation because it helps them delay it a little bit.
Little side effect they're looking for.
A correlation I have found, and I would say a kind of a large percentage of my clients who experience this, is if their primary sexual outlet has been with masturbation and porn, two things are happening for a lot of these guys. One, if they're clicking around on the internet for a significant period of time, they're keeping themselves in a high state of arousal without allowing their bodies to experience the release of an orgasm until the very end. And the other thing that's happening is that they become very dissociated from their bodies. So you mentioned that, so if you think about it, if you're, clicking around on the internet, or if you're masturbating while you're looking at, internet porn, there's really not a whole lot of mind-body connection that's happening.
There's a lot of mind-computer connection going on, and the stimulation from your eyes.
Yeah, so that's something to kind of think about as well.
Other issues with ejaculation can be when you lose your erection.
Yeah.
Maybe it's not early ejaculation, maybe it's not delayed ejaculation, but oftentimes they'll come in because they're mid-experience and they lose their erection, and that can happen multiple times. Again, sometimes it's not a big deal for couples. Sometimes they just take a break. Maybe they start over. Maybe they switch positions. Maybe they focus on the other partner and getting them a little bit closer to climax, or just having a pleasurable experience.
Right.
But if they're coming in to see us, they've definitely determined that it's a problem for them. Something that can happen is we need to figure out what's going on with them in their brains.
Yeah.
What are the messages that they're sending themselves? What are they picking up from their partner? What are they deducing from their partner's experience of how they communicate? Whether it's nonverbal or verbal, they might be picking up on cues, and it causes them some stress.
And I've found, back to the, again, dissociation from the body, I have found that men who are overly focused on their partner's pleasure, while, yes, that's considerate, of course, to consider your partner's satisfaction, they become so focused on it that they lose their own mind-body connection. So it really is, in these cases, I think, about strengthening the mind-body connection and deepening relaxation, lowering anxiety.
And if there's been any past trauma, that's something that we can address as well for both men and women. But especially with erectile dysfunction, we want to make sure that it's not maybe a current trauma that you're experiencing, or something that's happened in your past or even childhood.
Right.
And we'll determine that as well and try to help you through that as well. There's lots of information online, but I can tell you that most people are helped when they come in to see a sex therapist, because we can very quickly figure out what the problem is and also give you some active tools and assignments to get you going, both as an individual in your sex life, but also with a partner. And opening that communication to a relationship, and in couples therapy for sex therapy, is something that we can do pretty well. So we want to invite you to give us your comments, any questions on our YouTube, Facebook, websites, hashtag Hot Seat. That's HOTSEAT. And we welcome all of your comments and questions.
Thanks.
Thank you.